Good morning to you, Jamie.
Morning, Julia.
Thank you so much for joining us. The key phrase here is we talk about free lateral flow tests. They're not free. We have to pay for them. We're just not paying for them at the point of use. And I say point of use instead of point of need because there are millions of people who are testing very regularly, who are perfectly healthy and well, not at risk. I include school children, utterly pointlessly, who've had COVID a couple of months ago, being tested twice a week, and they're perfectly healthy parents often as well. Do you think we should end the access to, at the point of using them and getting them, free lateral flow tests?
No, I think we should, Julia, because if you think where we are now, we've got significant population antibodies from people who've previously had an infection or people who had the vaccine. And the cost of all of this is getting quite astronomical. If you think I think Boris Johnson was saying in January alone, it was about 2 billion a month. Now, we had a mass peak in tests over the January Christmas period. But remember, the kind of the cost of living is going to be going up in April with national insurance rises. That's to raise £12 billion. So if you continued with the same level of testing that what we were having in the last month, then you'd eat into that. And then within 6 months, Julia, and remember now that the purpose of raising these taxes is to try and tackle the backlog of the NHS. And just the ONS published some figures yesterday, just the amount of money that we borrowed over the pandemic and kind of with interest rates kind of starting to go up as well, is that we spent 6 billion alone just on servicing the government debt in January. Yeah. You know, that's money that has gone, basically. We can't spend that on public services. So just on the testing, Julia, what's the purpose of doing it? Well, one of them is surveillance. We're going to continue with the ONS infection survey. And the bit here that Boris is kind of stopping is the control bit, which is to try and stop people mixing. But remember, half of people who are infectious never got tested anyway. So it's not a case of everybody's going to start infecting everybody. And in the first few days where you don't have any symptoms and you are infectious, you would have been infecting any people as well in that instance. Yeah. So it's not as if the testing has been kind of the be-all and end-all.
Well, indeed, and we've tested on a scale far, far greater than almost any other country in the world. I mean, so much greater if you look at the number of tests per million of people in this country. And yet, there's no evidence that has actually led to fewer cases. Look, the reason why we've been able to open up is because of vaccines and basically political will after pressure from backbenchers. Let's not pretend that's not been playing the major role on that front, rather than the testing capacity. Plenty of other countries are doing far, far fewer tests. Do we know who is taking all these tests? Because even looking at the stats, when it was sort of 1 million tests being done a day, I remember in the autumn, and I'm thinking, well, hold on a minute. Every single school child is supposed to be being tested twice a week. That's far more tests than that should be taking place. I certainly never tested my child. When she'd been to a sleepover and 5 kids at the sleepover went down with COVID, then I thought it was responsible to test her. Other than that, no. And then what a surprise, she had COVID. Do we know who's doing this test? Is it just the worried well who are just testing every single day? Lots of offices requiring people to take a test before they even walk into the building, with no particular purpose, because of course, the vast majority of people are not, after being double jabbed, or even if they hadn't been double jabbed if they're younger, are at any serious risk from this disease.
No, Julia, the tests are broad across the whole population, but they are being kind of disproportionately used in many young children, obviously, with school screening, which will come to an end. And you're right. What was the point of testing people who've had Omicron recently in the last month or so? We know that kind of testing, all that's kind of done in a way, Julia, with the mass testing that we've had in the population, is scared other countries to allow us to go there because we've been identifying more and more cases.
The more you test, the more you find.
Indeed, and I think basically when you start looking in terms of kind of the overall number of tests, I think you've been talking this morning about kind of care homes and where people are going to visit people in care homes. Now that's an actual bonkers idea if you think about it, because prevention is always better than cure. So they say they will allow free lateral flow tests to care home residents if they show symptoms. Well, of course, they're only going to get symptoms if they catch COVID. So surely you would want to stop people going in with COVID. And
so you would encourage, you think that people, it seems to me, and I don't want to keep the madness going on anymore, and we need to start treating this more sensibly, but someone testing before they go into a care home for the lateral flow test seems to me to be something that would be a good idea. Perhaps if we tested a lot of elderly relatives who were taken out of hospital beds and put into care homes back in March 2020, we wouldn't have seen, was it 30% of those who died in the first wave living in care homes?
No, indeed. And to say, what's the point of testing them when they have symptoms and they've got it?
Yeah.
Because that might be the point when they go into hospital. And remember, if they do fall ill and catch COVID off somebody going in, they'll be tested when they go into hospital anyway. So,
Yeah.
so I think there are some instances where there seems some common sense that we've got all of these tests. I'm sure the government has still got, hundreds of millions of tests lying around, Julia, anyway. So it's not going to be a big burden in terms of doing that. I think ultimately, though, we're at that point in the pandemic now where deaths didn't go up over Christmas significantly. We've seen the number of patients in critical care beds overall, not just looking at COVID, below pre-pandemic times as well. So in terms of this living with COVID plan that Boris is coming out with, we need to do that. And I think getting the money that's being used for testing back into looking at fixing people with hip operations, cancer screening, that's got to be the priority now, because all lives matter, not just the COVID ones.
And this is the key thing, isn't it? We've got to focus on lives that actually can be saved, and putting their resources into, saving a 30-year-old from cancer that's been undiagnosed, frankly, is more important to me than the worried well sort of virtue signaling before they go to the pub. And again, there is an opportunity cost of this. In terms of the stats we're at right now, Chris Whitty and Sir Patrick Vallance standing beside the Prime Minister on that press conference on Monday night were making the point about how we are, not only we do not have excess deaths right now, we have below normal deaths right now from anything. And yet we've still got so many medics and scientists who are saying, so you're saying that 100 deaths a day is acceptable from COVID. Now, you're the former head of health analysis at the Office for National Statistics. You understand this stuff. The stats that we are seeing right now about the number of people who are dying with COVID, those are not a true representative of the numbers of people who are actually dying with COVID, are they?
No, so the figures you get each day are people who are dying with COVID, and the better estimates are the ones that come from the ONS, where they look at COVID mentioned on the death certificate. Yeah. And you're right, we are seeing deaths like yesterday's figures, Julia, that came out. The number of deaths registered in the last week in England and Wales was lower than 2019, 2018, I think 2017 and 2015, so we are seeing below average deaths. Remember, the huge number of deaths we saw over the pandemic might have a bit of an impact, because obviously some people who've died earlier may have been dying now, but it's quite clear that the mortality, everybody obviously doesn't want to see a sad death, but the true reality is people get born and then people die. That's the true reality in life. And the COVID is still one of those viruses that is disproportionately kills the elderly. And if you compare England and Wales, Julia, over the pandemic, Wales have had more restrictions than England, and the death rate is exactly the same. So I think when you do the inspection and look at the inquiry into all of these different lockdowns that we've had, whether they had a big material impact in terms of different countries, it's not looking likely.
Well, indeed, it is not a political position. It's simply like the data, you look at the data, this data does not show that there has been that big difference. And this is the key thing, is that, a lot of people, I think, only woke up in March 2020 to the idea that people did die. When people talk about 100 lives a day, I mean, again, a lot of those people are simply who are incidentally testing positive for COVID, along with 1 in 20 people in the country. And we know spreading in hospitals like wildfire as it did throughout the pandemic. But the crucial thing is, another 1,500 people die every single day of other stuff, but we don't seem to talk about them.
No, and I think, quite clearly, first wave, a lot of excess deaths, quite clearly in the second wave. And through the summer, Julia, we have seen weeks where we've had excess deaths that are non-COVID because of people who've kind of stayed at home to protect the NHS. Yeah. And that's the priority. I think, just thinking of the money on these lateral flow tests, Julia, we don't want to be going into next, November time with people calling for lockdowns or restrictions.
Oh, we will, though. We absolutely will.
No, indeed. And that's where we need to start thinking now. This money needs to go in terms of, let's make sure that the capacity is there, because, I'm sure before the pandemic, Julia, you were probably talking about the NHS being overrun, and we knew it was overrun because that's what the headlines would come up. So the priority for the government now is to focus on looking at the NHS, looking in terms of how it's structured, and let's not have talk of restrictions next winter because the NHS cannot cope.
Exactly. Thank you so much indeed for joining us. Jamie Jenkins, former head of health analysis at the ONS.